Good morning, everyone. This is Raquel at the University of Rochester. Can everyone hear me?
I know.
Hello, yes.
Yes, we can hear you.
Yes, okay, great. Thank you.
Really, you're doing that.
All right, we're going to get started at 5 after 11, and we want to be mindful of time.
I'm also there for. Nice. All right, we just everything.
We will mute all phones just because this will be recorded. If you have a question along the way, there is a chat on your screen on the lower right of your screen. So please enter your questions along the way.
Maybe Sue can go out with the yeah, she said she just called the mother's at work.
If you are encountering any technical issues, please try reconnecting, or you can also email Glenn, and she can help you along the way.
We'll drive by, yeah. And then if she's not there, I'd call her and say, you know, this is the situation. You know, if you know, right.
All participants are now in listen-only mode.
Well, good morning again, and we're going to begin now with our presentation. So we wanted to take the opportunity to introduce our COE program, the team, and what you can also expect our work to be together.
It's being recorded.
Just as a reminder that we are recording the webinar to keep it in our archive, but in case anyone who was not able to participate today can listen at a future point. I also, just before I get started as well, want to remind people, I know that some of you registered other staff, and if you can send Glenn a note of who are the other staff that are attending with you as a group, just so that we can have an accurate count of people who were able to participate in today's call. Okay. So just to give you an overall goal of the COE, and it is really to support the New York State Department of Health efforts to promote a standard of excellence among programs funded statewide through the Maternal and Infant Health Initiative. And the way our COE is structured is in two parts. Part one is the training and technical assistance and evaluation, which the University of Rochester Department of Public Health Sciences was awarded. And then the part two, the development, maintenance, and management of a data management information system, which is awarded to SUNY Albany. Both of these programs were awarded in July 1st of this year. So I will now describe our program here at the University of Rochester. And our part one goal is to provide training, technical assistance, and expertise to the New York State Department of Health and also all grantees on the development, dissemination, and implementation of evidence-based strategies to improve maternal and infant health outcomes and to support evaluation activities through data collection and analysis. So I will spend the next few minutes describing our Part 1 COE program. We'll allow a few minutes for questions, and we will then pass it over to SUNY Albany to describe their program as well. Here is our COE team. And I will now give you a little bit of background of each of the faculty and staff that make up our team.
So, hello, my name is Ann Dozier. I'm essentially the PI for the overall project. I have been involved with maternal child health and women's health since 1980, and I've worked primarily in the upstate New York region, although I've done a number of other activities across the country in terms of trainings, as well as work in some international settings. I am currently also the chair of the Maternal Child Health section in at the American Public Health Association, and also am a delegate to the U.S. Breastfeeding Committee, so I kind of bring a bit of a national perspective to some of the work that we're going to do together. I am looking very much forward to working with you all and with the state and with our colleagues at SUNY Albany on this journey, and we'll talk a little bit more about that as we get into the rest of the webinar and as we continue to work together this year.
Here's Dr. Alio. I'm going to unmute the line so that she's able to.
All participants are now in interactive talk mode.
Hello, everyone. My name is Amina Alio, assistant professor at the University of Rochester. I have been working in maternal child health for over 10 years now, and primarily looking at disparities in pregnancy outcomes, preterm birth, infant mortality, et cetera. And I'm also very much interested in the role of fathers during pregnancy and the impact it has on pregnancy outcomes. I currently work as the evaluator for Healthy Start in Rochester. And I've done this before. I've worked with Healthy Start for the past 7 years in Hillsborough County in Tampa, Florida. And I also do some work globally, but primarily with African Americans in the United States. And I'm excited to be part of the COE and look forward to working with all of you. Thanks.
Thank you, Dr. Alio.
All participants are now in listen-only mode.
And here I am. This is Raquel. I received my master's in education through Central Michigan University. I have been in the public health field for 15 years, and at least the last 7 years before taking this position, I was providing training to community-based organizations nationally, and as well as providing capacity building assistance to health departments on a national level, and that was through CDC-funded program. Many of the trainings I conducted through that were evidence-based interventions, as well as public health strategies that the CDC were asking programs to implement. And so I look forward to using that expertise within the activities of the COE.
Good morning. My name is Sarah Vitello. I've worked in the research field on multiple studies and served as project coordinator and recruitment coordinator on initiatives focused on maternal and child health and mental health. I will be joining the Center of Excellence team as the evaluation coordinator, and will also be serving as the point person for an additional evaluation with the home visiting programs in regards to client retention. And I look forward to working with everybody on the Center for Excellence.
Glenn Schultz, which you have received multiple emails in the past week. She is the person that you will most likely have the most contact with. Glenn will be sending email communications regarding future webinars. You may have received also an email communication about this assessment survey, which I will talk about later on, and other trainings that the COE will conduct with you. We also are planning to hire a staff scientist as part of our program, and also a graduate student, and we're still working on getting those two individuals. All right, moving forward to our focus area, the COE focus areas. So here's a visual diagram of our main work. Some of the activities are directed to both the grantees, and some of the activities will be to individuals, specific to either Mich program or the MIC-V program. So to start with the evidence-based, best practice strategies resource. So one of our, this is one of our areas, and is to really be a resource in identifying evidence-based strategies or best practice strategies. And our goal is to provide capacity building and training on these strategies that we identify. We will conduct literature reviews and research new trends so that we know what evidence-based best practices are out there that best fit your work. And we will consult with national experts as well to provide us with expertise. The COE will also have a website where these publications will be uploaded as a resource to you. This website would also have a calendar where you can view future trainings, and you can register for trainings as well. But that is still in development. Our second focus area is training and technical assistance. First, just so that you're all aware, trainings that we will conduct will be in these 4 regions, the Buffalo, Syracuse, and Albany, and New York City areas. It is open to all programs, so even though there's specific regions that we will have the trainings, it is open to anyone in the area to attend, of course. Trainings, depending on the topic, will either be grantee-specific, or it may allow, depending on the topic, both grantees will be in participation. So,
I mean, grantees in terms of some will be maybe more focused for the home visiting folk, and some may be more for the MICHI, and some will cover both groups. It really just depends on what the content area is.
Right. And some of the areas, the priority areas that we will focus our trainings are in mental health, substance abuse, and domestic violence. So earlier we talked about evidence-based and promising strategies. We will also provide training and technical assistance on the selecting and also in the implementation process of these. The COE is also will be in charge now of conducting the CHW, the Community Health Worker trainings, which you may be familiar that Chikateli has been conducting for the last number of years with you. So we are currently in developing a revised curriculum for the newly hired CHWs, and in the future we will also develop trainings on enhanced topics that are pertinent to the CHWs.
And we're aware that right now, because of the transition, that the current CHWs are being offered the opportunity to attend the trainings offered by Chikateli through into next year, because we have our deliverable isn't for a number of months to come up with the a different or an updated introductory training, and we're right in the process of putting some of that together. We'll be working with several of your organizations to kind of vet, what the approach that we're taking. I know there was a question that was sent to us about kind of how similar or different it's going to be. I think we'll certainly use some of the Chikateli information. We'll kind of bring in some other, potentially some other content as well. So we're still in a very much of a formative stage, with this. And I think part of this is also because we're looking across not just the prenatal and immediate postpartum, but, dealing with the interconception content and preconception roles and responsibilities as well. So this is where it's a little more fluid at the moment. And as I said, we'll be working with several of the organizations to help us to review what we're doing. And then some of the information we're going to gather through the needs assessment will also help us set some priorities as well. And those of you who are in the Mich site should have, I think, received the access to the needs assessment last Friday, and the folk from the home visiting will get that in the near future.
So this is our second focus area. Our third is around evaluation and data management. And here are some examples of the tools that we are currently developing that at some point in the near future we will be sharing with you and working with you on how to use each one and what it means to your program and what the data will be collecting as well, and that process of implementation. So Amina and Dr. Leo and Dr. Dozier, as well as Sarah and I, will be developing these tools and working with New York State Health Department to with the process of developing and also approval. And once we have that final approval and next steps, we will be sharing that with you and helping you in terms of how to implement it into your program. We are also collaborating, working with SUNY Albany as well on how to work together on the data management and analysis piece of this, the COE. But we're still working on that, and more information will be forthcoming on how you will work with both of us in SUNY Albany. Okay. So, as Dr. Dozier was mentioning about the organizational assessment, just to kind of give you all a background, the intent of this assessment is to really get an idea, a picture of how your programs are structured, what your needs are, what your training needs are, what are the capacity building assistance areas that you need to us to help you with as well. So there are two different assessments. There's one that is directed to the Mich programs and one that is directed to the home visiting programs. Last Friday, we sent the Mich programs a link to that survey. I know that one person has completed it. Thank you. So we have some data on one person, and one agency, yep. So thank you so much for doing that and being so timely on that. We did send a deadline on that. We want data. We asked you to give you feedback by December 4th. It's a Friday next week. And really, this is to guide us in the next year and how we can focus our work with you. The home visiting programs, we'll send you a link in the next week and a half probably as well. And it's basically in the intent and purpose of it is the same. And then we also expect that we will repeat each year just to help us on the training needs aspect outside of the COE, so that we are focusing on trainings each year in areas that are significant and important to you and your staff.
The interview.
Thank you. And then after we have received your completed assessment, we will be following up with you to conduct interviews so that we can follow up on some questions that we may have from your feedback on the assessment, and then to get further information about your program and needs.
And this will help us get to know you as your agency a little better, since we are all a bit geographically dispersed. We're not in a position to do site visits to every agency, so this is our opportunity to learn a little bit about you all and for you all to get to know us a little better, and will further help us refine our priority settings. Our priority setting processes. So once you submit your needs assessment, you'll hear from us to set up a phone interview. We expect it'll take about maybe 45 minutes. It really will depend on kind of how complex your program is, et cetera.
one of our really big and main deliverables is convening a 2-day conference, and this is a save the date. We have scheduled it for May 4th and 5th of 2016. It will be at the Desmond Hotel. I think many of you may be familiar with the Desmond Hotel in Albany. So Glenn has worked with the Desmond Hotel in getting room rates, and so here's a number and a link that if you want to make reservations. We will also ask for abstracts as well. We intend to send you the form in early January to get presentation. You can present or have post a presentation as well.
So there's no cost to attending the conference in terms of a registration fee, and lunch is provided. Your obligation will be to pay for your transportation and the cost of hotel and other incidentals, but the meeting itself is not. There's no cost. We will want people to register so that we get a head count and can do some planning.
So at this point, as we are wrapping up our portion of the presentation, you may be wondering, what does the work of the COE have to do with our work, or maybe possibly thinking this is more work on top of what I already do. And I can completely understand that. But the way we want to see it is our goal is to really work collaboratively with you to help you meet your program goals, which in turn really will impact the goals of the New York State Prevention Agenda and the Healthy People 2020. And so the way I see it is we will be doing some of the local work, but our local work does impact the things that are happening statewide and also nationwide. It's just a refining process and improving our work, improving our strategies so that we can meet some of those long-term maternal and child health outcomes. Here's a list how to contact us, either via email or phone. You may already have Glenn's email as she's been contacting you in the last week. Feel free to, send us an email, calling us for any questions that you may have. At this point, I'd like to allow maybe a couple of minutes for any questions or comments you may have in terms of our COE before I pass it over to SUNY Albany. I'm going to unmute your lines.
All participants are now in interactive talk mode.
Good morning. This is Roberta Holder-Mosley with the New York City Department of Health. Will this PowerPoint presentation be available to us electronically?
Yes, we can, yes.
Thank you. That would be very helpful.
Not a problem, our pleasure.
Good morning. This is Maria Guevara from NMPP, and my question is, when do you foresee having training ready for community health workers and also the database ready?
Right. Okay, so I'll add that to it.
So the training for the community health workers so currently Chickatelli is doing the training. Our training will not be available until into the spring. So I know Chickatelli has scheduled trainings into I want to say well into June. Which gives us enough time to get ours up and running and beta tested.
Then we'll do it for next month.
Can I remind everybody who's on the line that we're now unmuted everybody?
Okay, no problem.
As to the database, I will allow our Part 2 colleagues to respond to that, but that will require, one of the steps that we need to take is to finalize the performance measures which is work that we're doing with the state, and actually in the second draft of, or second or third iteration of that. And once we get the performance measures finalized, then that helps inform the database. But we're also very conscious of trying to figure out how we can align with other federal initiatives that are going on to try to connect across various data systems so we aren't creating duplicate data requests. So we're trying to, so it'll take a little while for the performance measures to get finalized, and then the database will come out. And I will let Rose speak more to the details of the database.
Hello, this is Melrose Corley from the EOC of Nassau County. At what point will you provide technical assistance on our current implementation strategies?
So part of our organizational assessment is to find out what your current implementation strategies actually are, and then we can figure out how we can, what your needs are. And part of the organizational assessment will help us figure that out. So I would say once we get the needs assessment, the organizational assessments, needs assessments done, we will set some priorities and figure out how we can do that. But sooner rather than later, I guess, is the short answer of that. And when we have our interview with you, if there's particular needs that you have saying, oh, hi, we'd like some help with this, that, or the other, that would be the time to help us identify what those are. Good question. Thank you.
We have a question in chat.
Okay, chat question, yes?
Yeah, can you address what our agenda will be for the May conference?
That we are still deciding on the agenda piece, but we're trying to focus on the systems level and partnerships
aspect of that. Yeah, and I think the other thing we're doing is we're going to help some of the organizational assessment, some of the training needs will also will inform the conference as well as the trainings. So that will that's going to help us figure out what some of the priorities need to be at the conference. And some of this is a balance between what do we want to have kind of the larger groups available and to present to, and what kind of content is better focused on, you know, having it more across the state or done in webinar format. So we don't have a specific agenda. We will have a national speaker coming in, and we are in the process of determining who that might be. So stay tuned.
Two more questions on the May conference, Ann and Raquel. First of all, should they invite or can they invite subcontractors, and who is the expected attendees at the conference?
I am not sure about the subcontractor question, but we will get back to you because I need to get some clarity from the state about that specific question. And I would expect, so we have, I believe we have space for several people from each agency to be able to come. But some of your agencies are bigger and some of your agencies are smaller. So I would expect whoever is your program coordinator, I'm not certain I have the title right, would certainly come and then identify who in the agency would be the best other people to come, whether it's whether it's other staff members, whether it's somebody who works on your court, works on your evaluation. Because we aren't as clear at the moment on how everybody is structured, I'm not in a position to say, oh, this title and this title and this title. So we want to make certain that we're, so I don't want to be too prescriptive at this point. When we send the announcement out, we'll certainly have some more clarity about it. We just wanted this to get on people's calendars well in advance of the date.
I'm sorry, could you repeat, this is Roberta from the New York City Department of Health. Could you repeat the dates again, please?
May 4th and 5th.
Thank you.
It's a Wednesday and a Thursday. Yeah, so. And they'll be all day to all day. So I think we're going to transition over to our Part 2 colleagues to make certain they have enough time, and then we'll be back on the line for additional questions.
Okay, because I do have two more questions in chat, so I will bring them up at the end.
Yes.
Yeah, that would be great. Thanks, Lynn.
I'm transferring the presenter role over to our SUNY folks. Oh, they've already got their presentation up. Great.
Good morning, everyone. This is Rose Green. I'm from the Center for Human Services Research, and I'm going to be talking about the data system development for the Center of Excellence. This first slide is our team. A lot of people, when they hear about an evaluation center.
Can you please speak up?
Sure.
Thank you.
A lot of people, when they hear about an evaluation center, think of a bunch of research nerds and IT geeks, and I wanted to present this slide to show what an awesome group we are. So anyway, our center consists of 2 units, a research and evaluation unit and an IT unit. And the Center of Excellence mostly involves our IT shop, which develops applications for human service providers. We develop the MIS Healthy Families New York and Healthy Families New Jersey, New York State Family Resource Centers, prevention programs. Some work with parents.
All participants are now in listen-only mode. All participants are now in interactive talk mode.
So now I'm going to talk a little bit about how we're going to develop our system.
Please speak up.
Our approach will be a very participatory approach. We don't have a canned package that you will need to fit your data elements into. We will design the application around your needs and with your input. The data system will not only meet the needs of state administrators, but will be very useful for program managers and frontline staff because we know this is the best way to ensure timely and accurate data entry. So now I'm going to get a little bit into what our process is. So the first step is we are in a information gathering phase. And we began that with making some site visits. So we visited the Regional Perinatal Network meeting in Albany in July, have been to the Albany County Health Department, the Institute for Family Health in Dutchess County, the Lower Hudson Valley Perinatal Network in Rockland, Mothers and Babies Perinatal Network in Broome, Niagara Falls Memorial Medical Center, and the Buffalo Prenatal Perinatal Network. And this gave us a good idea of what's going on in the field. However, we don't have the resources to visit every site, and so the next step is to telephone interviews with each of you to gather additional systematic data to ensure that the web-based system is responsive to the needs of all programs. So we will gather data on your technological capacity, the strengths and weaknesses of current systems, the ways in which data are used, and tools that need to be built to ensure that the new system is responsive to staff supporting needs. We will also be collecting, and have done some of this already, existing forms and documents so we can crosswalk each one with the new performance measures to identify the data points. The next step in the process is to determine the data elements, and we anticipate that data will be collected at intake and assessment with each encounter and referral and at discharge. And although this is in process, there are some questions we anticipate the MIS will answer. These will include what are the characteristics of families seeking services, what are the needs of families at intake, are women and infants health insurance, are medical, behavioral, psychosocial risk factors being identified, are they addressed through timely services and referrals, what is the frequency and duration of services, what types of services or referrals are being provided most often and least often. And the data system will provide a number of outputs. This is just to give you sort of a flavor of what you'll be able to get from the system. The system will produce tickler reports, which will consist of reminders and prompts to alert staff when client follow-ups are needed or certain forms are due. Management reports to inform timely and ongoing supervision of workers. State reporting documents, so with a click of a button, you'll be able to provide the state with all the required information. Programmatic records such as new client enrollments for designated time periods, referral logs to services, and follow-ups. Tables that display client characteristics and will also be available to you to run additional ad hoc reports as needed. Step 3 will be determining the technical requirements of the system, and I'm not going to go into detail now, but we have extensive security measures for all applications, and data storage procedures will be HIPAA compliant, and we can send you detailed information on the security measures being built in if you'd like. I know this is a very this is a big concern of many sites. And then finally, we will be providing extensive hands-on training and technical assistance and operate a help desk to help you navigate the system. This is our contact information, and now I'd like to open it up to any questions.
Hi, this is Raquel. Does anyone have any questions for SUNY Albany? If I can ask agencies to mute their lines, please.
Hi, this is Maria from NMPP. You know, the million-dollar question is, how long do you perceive this process to be? We are struggling with the reporting part to the state because we're counting case-by-case information based on the form that they sent us, the HW encounter form. I don't know if you have seen that. So it's really difficult for programs that don't have a database to have to collect data and send the information to the state. So I am very much interested in knowing how long this process is going to take.
But part of the development of the database is dependent on when the performance measures are finalized, because we need to determine the data elements based upon the required data and the performance measures. So I hate to give you an unrealistic idea, but I would say maybe 6 months after the performance measures are finalized.
Hello, this is Melrose Corley again from the EOC of Nassau County. If the data management piece is put together before this program year is out, do you anticipate that all of the clients that we are seeing beginning this program year, that we will have to take some time to input the data so that we can get the reports out for this program year?
Yes. I hope at this time that they would not put you under that kind of pressure, that we would not require you to put everyone in such a short time frame. We'd also take a look at your current data system to see if it's possible to possibly import some of the data into the new system. So you wouldn't have to do all that, at least not names and addresses and dates of birth.
As you're planning this, and I know it's not final yet, we are also funded by Department of State. So we have a lot of client characteristics that we currently input into an Excel template. Do you foresee having some of those same data? And I'm sure that there are some additional ones that are found on the encounter forms that we're trying to track as well. Would that be sufficient for you to possibly import into whatever database you're preparing?
Any data that we can possibly try to get out of existing systems and into ours will do, but we don't even know what data elements we'll be collecting yet, so I can't.
Rose or Chris, this is Sharon Chesner.
What was that?
Hi, it's Sharon Chesner from Mothers and Babies.
Hi, Sharon.
Hi. I know a lot of times in some of our other programs, there's they give us advance notice of what level of sort of capability we need to have as far as our systems go. Do you foresee that there's going to be any special sort of the IT capabilities that we'll need to have in order to access or utilize this database? Is it going to be web-based?
It's going to be web-based. The only specific item I'd say that you will have to have is a system with Windows Explorer 10 or higher. And that basically means that a Windows XP machine will not be supported in the data system.
Chris, you said Windows 10, is that correct?
Web should be fine.
Chris, you said Windows 10, is that correct?
No, I said Explorer 10. Anything with Windows XP will probably not be able to connect to the system.
Thank you.
Thanks.
Other questions that folk have? Go back to the ones.
I have some from chat, if I can read those.
Thank you.
In the beginning of MICHC, the CHWs were told this is not a case managing program, but a program to connect participants to services like a bridge of support and empowerment.
Okay, so the question is, has that changed? I assume that that's what the question is, whether there's been a shift to case management. I think one of the questions that our state colleagues have asked us to determine is a balance between of caseload and what should the different mixes be with prenatal, postpartum, interconception, as well as preconception, since those are the 4 areas that the program is to focus on, and what should be the balance with that. And that's actually one of the areas of discussion that we're going to be having with we have a community health worker team within our group here who's going to be meeting with several of the agencies to help us answer some of those questions. In terms of whether, if you're asking, do CHWs do case management, it's my impression that that is part of the role, but I would not be the person to define the CHW role. We're here to support its implementation. So I think if there are questions about what the CHW should and shouldn't do, that some of that clarity is going to come from the working group that we have, because I think this seems to be a bit more fluid than I think has been possibly in the past. I'm not certain if I've answered the question adequately. You can ask again on chat if you'd like.
This is Cheryl Hunter-Grant from Lower Hudson Valley. I didn't ask that question, but that would be one thing that I would see as a priority in getting the clarity on that. We have a subcontractor that was previously the Community Health Worker Program and others that are not, and as we're trying to carry out what we understand the state's intention is for this new thing, that it's not the old CHWP, but something new and a strategy versus the services, it would be extremely helpful to have good clarity on what the expectation is, as well as something in writing to reinforce that, so that we're communicating the appropriate message as the lead agency and are building appropriately what needs to be in place for us to achieve the goals, not only to meet what the community needs, but to meet what the state is expecting.
I 100% agree with you, which is why we have kind of tripped into this, and I don't think had an appreciation that there was some of this uncertainty. So we are moving on that. I can't give you a date necessarily, but it is certainly a priority because it affects everything that we do relative to the CHWs in terms of training, et cetera, et cetera. So we feel your pain and look to have something more concrete. And it's also one of the reasons why we're involving some of the agencies, because we're not the font of all knowledge about what how this should kind of look and feel out there either.
Hi, Ann. This is Liz from Reach CNY. Is there a way that anyone could volunteer to be on just like a think tank with you?
Well, so our state colleagues identified a few people for us to collaborate with. Once we get that group going, I think we'll get more people. We could potentially get more people involved, and I don't have the list in front of me to know kind of who got tagged for this. It was only a handful just to make it a manageable process for this initial discussion.
Sure, that makes sense, but I guess in any case we could always write up some comments and send them along.
Yeah, I think that's probably a good idea to have to have a mechanism whereby people can give their input. It's also, as with these interviews coming up, that it's also an opportunity for us to clarify how you all either are implementing the role or how you see it, you know, to be implemented, because that'll help us understand kind of where the hard and soft boundaries are around the role of the CHW, et cetera. And because, you know, your agencies look, you know, quite different, you know, what it looks like in one agency is likely to, you know, differ some from what it looks like in another, et cetera. So we will be working on this, and I think coming up with a mechanism where people can provide input. We just have to figure out what point that makes some sense. So.
Sounds good. Thank you very much.
These are good questions. Thank you all. Lynn, anything else from the chat?
Yes, we do. Multiple times, MIE-CHV was mentioned as a home visiting program and MIE-CHD as a CHW program. Can I please clarify this?
So there's two different kinds of programs. So within our context of the COE, there are 17 home visiting programs and 24 community health worker programs. So we are providing our training, technical assistance, and evaluation support to all of those groups. They are, but they have different foci and priorities within that. So we're trying to design any kind of training we do. Some will be specific to one group or another. Some will cover content that is pertinent to both. Part of our organizational assessment will help us see kind of where the similarities and differences are. I'm not certain if that answered the question or not.
Hi, Ann. This is Erica with the Health Department. I just wanted to add when we say home visiting, or what you were saying is home visiting is that's the federally funded maternal, infant, and early childhood home visiting program grant. So those, you know, while some of the CHWs do home visiting, when we were describing, MIH-COE is the evidence-based visiting program, only Nurse Family Partnership or Healthy Families New York programs.
Yes, thank you. I appreciate that clarification, Erica. Thanks. Yeah, it is only those two programs that when we say home visiting, that's what we mean. It doesn't mean that the CHWs don't do home visiting. It's just the 17 home visiting programs are the evidence-based programs and follow the guidance of or follow the protocols from Healthy Families New York or a Nurse Family Partnership.
Okay. This is Cheryl Hunter-Grant again, and I'll pick up one of the questions I had on chat because it's connected to something that you just said too. When we speak of MIH, and I know there's a CHW strategy, it's just one of the strategies in MIH, but it's my understanding that's not the heart and soul of MIH. So one, when we talk about the data system that's being developed, is it solely focusing on the CHW strategy? And two, when we talk about training and the systems piece, are we going to have an equal emphasis, unless I'm just misinterpreting MIH, an equal emphasis on those other systems changes as well as the community organization component that I believe was an important, as equal in a strategy that's part of MIH as the CHW. I'm hoping that it's just this learning curve as you get more aware of the depth of the program and that I didn't miss the mark on what the state's expectation was for MIH. But I'm hearing more a clear slant towards CHW, and I'm concerned about the ability to get the support that we need to carry out all the other aspects of MIH.
Oh, no, you're not at all off base, and thank you, because that imbalance was not intentional on our part. In fact, the performance measures are both for individual clients as well as kind of partnership systems level performance measures. So, and yes, the data system should be designed to capture both of those. I think the focus on the CHW is that that's where there's been more pent-up demand. It's also one of the early large deliverables that both the Part 2 and Part 1 sides of the COE have. So you are absolutely correct about the partnership piece, and that's actually one of the areas that we're going to be emphasizing in at the conference as well. Please don't. We'll talk more when we have our individual discussions. But you are quite correct that this is not a CHW program. It is a program that has several components to it, and the partnership and systems building and systems changes is a major part of that, and that is a very important. I don't know whether to call it a pivot that the state has made with this new funding. Thank you.
Thanks, and I just hope, and I understand the demand for the CHW, and some of it, since we've got a number of previously funded CHW programs, that's been some level of low-hanging fruit, but I hope that to make those philosophical changes, we recognize perhaps the even more pressing need to provide the assistance in that non-CHW world for us to fully reach the goal for Mich statewide.
Absolutely, and I would hope that our organizational assessment will help us figure out, because we actually don't know what people's strengths are, where they see their needs are in that kind of partnership and systems building work. So that's why we're doing those organizational assessments, because I don't know where people are with their comfort or discomfort or skill with implementing those things. So we look forward to those discussions, and it was a great question. Thank you for asking that.
And this is Sharon Chesna again.
Yep.
Okay, so one, I echo Cheryl's concerns, and you know, we really do think that it's essential that we have all of the larger components, if you will, of the Mich in there. But one question, and whether it's for, and I know you said you don't know yet what all is going to be included in the May program, so this sort of goes back to maybe Chris or Rose. As you talk about particularly training for the databases, and Rose, I believe when we talked before, you thought it would be a while before those are ready to go. So I'm anticipating that maybe we'll at least have an update in May, but probably not ready for something to be rolled out. And when something is ready to be rolled out, if we could have notice as much as possible, particularly if it's required that we send staff someplace for training, because with, you know, the requirements for the, particularly now the 8-day CHW training and then the 2-day program in May, you know, these are things that have to get factored into our budgets, and they put a big draw on our budgets. So any further training, we have as much notice as possible on those.
And I literally like walked in the door and
we're going to try to do.
Nurse, can you give her a letter?
Hello.
But also we're
Can you please mute your line?
Here, go ahead, Chris.
We're also hoping that we can do webinars as well for training, just like we're doing right now, so that we can do data entry training and other types of training right over the internet, so that you don't have to send any staff out to save costs. Did I answer your full question, or did I miss something?
That's perfect, Chris. Thank you.
Thanks, Sharon.
Yeah, and as much as we can do things that don't pull the staff away, we will do that. That said, the trainings that we have been committed to do are training. There are several on-site trainings that would be held throughout the course of the year at the different sites, but it won't necessarily involve all the staff. It'll be depending on the topic. You'll figure out who you would send to a particular training, et cetera, et cetera. So we will, and the idea is to get a calendar out of that in advance enough so that you're able to do your budgeting as well as your scheduling for that.
Lynn, are there any other questions?
This is Rachel Schwartz. Can you hear me?
Yep.
Yes.
Hi, so I'm wondering if for those programs that do have a web-based data and case management system, if you have a sense of whether the new system will kind of override the need for that. I know those of us that do have a very expensive system are kind of concerned about that. Do you have any sense of that yet?
No. We've been to a lot of sites. The needs in terms of data systems varies drastically from site to site. So that's going to have to be an individual assessment with each site, what their current data system is and how this new system interacts with that.
Okay, thanks.
Raquel, I do have, I think, 3 more questions.
For me.
Okay. Are you contracted to do ongoing training or just core?
For CHWs, there's ongoing, if that's what the question is. Yeah, it's not just core training. The anticipation is we will have more advanced level training that we will make available.
Okay. Next question. Will it be a combined MICHD and MIECHV session in the May conference?
Both programs will be invited. Some of the sessions may gear towards the MICV programs, and some of the sessions may be best geared towards the Mich programs, depending on your the work plans, and then also what you would suggest that you would like to see at the conference.
Right. So we may end up with a breakout so that we have some content that's only for the MICV home visiting piece, and some that's only for CHW, as well as some general sessions that combine across both. But so we're trying to meet the needs of the 2 groups. And that, as we said, with these organizational assessments, we'll get a better sense of where the commonalities are across them. But I would expect there will be some that will be only for one group and only for the other, so kind of like a type of breakout.
What's the other question, Glenn?
Yep, next question. My agency has their own database. Will the COE database be able to accept uploads from our databases?
The plan is that we'll have a specific file format that if you can export data into that file format, that our system will import that into the system.
Any other questions?
Will the database require confidential data and protected health information like names and social security number and diagnosis to the point where we will need to have clients sign an ROI for input of their data into this database?
We haven't determined the data elements yet, but I don't think we're going to require social security number or particular diagnosis, but that's still to be determined.
Thank you. Any other questions in the chat, Lynn?
None that haven't been addressed. I think we're good. I have a couple notes I'm just sending back to folks privately, but nothing that needs to come out in the conference. Thank you.
Okay, thanks.
Any questions from any other questions from the folk who are on the line?
Yeah, one other question.
Yes, I have one last question about training for the first group. Is this going to be, I know you don't have all the details, of course, you explained the process, but I would like to know if you were contracted to do ongoing training for the staff at different levels, or just like the core trainings and some webinars here and there. You know, kind of have a little bit more of an idea of how the training piece is going to look like. Because, you know, we have to budget for training, and so we need to know maybe a little bit more if you can, as much as you can share.
There will also be ongoing trainings as well for various staff levels.
Right.
So again, the organization assessment will give us some information on that. When we interview you, we will get some more information about your training needs as well, and what staff levels, whether it's the coordinator, the leadership, or other outreach staff that you may have that need a different set of training. And so there will be in-person trainings, and there will be webinar-delivered trainings too. And the hope is that the trainings that we can deliver via webinar can not be a budget constraint on the agency part. And most of the trainings that we intend to deliver will be half-day.
Like the in-person ones, we would look to be doing kind of a half-day kind of commitment, but we do intend to plan to do all levels of staff if that is a need, which I assume it is, but we're trying to learn from you all kind of where the gaps are in your the training needs for your staff. So the short answer is no, not just core training.
This is Cheryl again. Will the core CHW training that you do in person, will that be recorded as well? We sometimes have staff turnover such that new staff come on a good distance away from the next scheduled training, and it would be helpful if there's some portion of it anyway that we could rely on to get folks trained in between the sessions.
Well, it's interesting because the initial requirement that was outlined in the RFP that we responded to was to do a web-based training only, and it really didn't have an in-person component to it. That has shifted some to look to do a combination, and one of the things that we are trying to figure out is how to balance that, as well as how to deal with the timing to address exactly the issue that you raised. So I don't have a perfect answer for you, but we're trying to figure out, because you don't want to have that, you want to have people be able to slip into it, I think, whenever they need. And again, those are some of the questions that we have, because if you have people who are coming into the CHW role who have, how experienced are they, or are they absolutely brand new folk, and they would need to get training kind of the day they roll in the door in order to be functional, et cetera. So we just need to get a feel for kind of how that, what the needs are, because we also understand that there can be some pretty significant turnover in that population as well. So kind of we'll see, we are aware of that and are trying to figure out how best to balance that out.
Thanks.
Any other questions?
Hi, can you hear me?
Yep.
Oh.
Hi.
Hi, this is Ellen Roisman from Suffolk County Department of Health. I just have a real quick question. I know that Chickatelli will be doing the core training for new community health workers and supervisors in January and February. I have 4 people who have to be trained in January and February. Just a question on will the training be similar that Chickatelli is doing versus what?
Well, so if your staff go to the Chickatelli training, I mean, what we're developing is introductory training to be implemented when it's ready, but it would be then instead of the Chickatelli training. So if your staff go to that, then if what you're asking is will they have to go to what we develop as well, I think that's going to be on an individual basis in terms of what you all think your individual CHWs need to have. We're not going to make people go through a second introductory training for that. It would be for your new staff hired, after the Chickatelli trainings are over. Am I interpreting your question correctly?
Oh, yeah, fairly, but I just wanted to know if the content was going to be fairly similar. We have the funding now.
Right.
Some of us are county health departments. It takes a good 8 weeks for most county health departments to get approval for the training. So we want to be proactive with that. And I don't know when yours will be ready. If you are not going to be ready until the spring, I'm going to have workers that have a year and a half of time in, and they're not going to have any basic training from any center of excellence.
Right, you guys, so you should be sending, so the Chickatelli training that's currently available is intended as a stopgap while we ramp up and get our training underway. Our training will not be available before the spring for sure, so you should be sending, and this is true for everybody, you should be sending your staff who need to be trained to the Ciccatelli training. Ours will not be available. That was the intent of providing the Ciccatelli option right now because of this pent-up demand, because it took longer than anticipated to establish a COE, and even in the COE, we were told we didn't need to get it done until at least 9 months into the program. So based on some of the delays we've already experienced, we will not have our part done until well into the spring at the earliest, because of some of the issues that we've just talked about with what's the role and some other things like that.
Okay, so then you're saying you're training on before the end of year 3, but not before spring.
Yes, yeah, if I'm understanding when your year 3 ends, yeah. So.
Okay, and one other question, is there any advanced training? I think that Maria asked that question.
Yes, there will be.
Will that be before the end of year 3? We're only asking these questions for budgetary reasons. Okay. And so that we can, we have lines and we have sufficient enough funding in all of the lines. Okay. So our budget for conference and training.
So your year ends in June, is that right or not?
No, our training ends September 30th.
Oh, it is September. Okay. Yes, we will be having trainings, advanced trainings before the end of September. So we'll have other trainings that are going to go on, and our idea is to come out with a schedule of what those are, kind of probably in the winter, to take us like 6 months or so into the future at least. So but I just don't know what the content area are going to be.
Will those be offered within the 4 areas too that you mentioned before, Buffalo, Syracuse, Albany, and New York City? Because that does have an effect on part of the grant on whether you take a train, take a car, or you need a hotel room for a night.
So the commitment is that each training that we do must be repeated in each of those 4 areas.
Okay, great. Thank you so much.
Hi, this is Rachel Schwartz with Public Health Solutions. We've got one more question. It's kind of a long-range question. Is there, with the data system and everything that's going to be starting up, is there an effort will there be an effort to kind of standardize the CHW process and assessments to eventually establish an evidence base behind the efficacy of the CHW program?
Yes, we're planning on doing that exactly as specified there.
Yeah, but in terms of trying to establish an evidence base for the CHWs, that's a much bigger task than actually what falls within our scope. Would I love to do that? Oh, yeah. Whether we're going to be in a position to do that, no. The data would probably help, but that's a much more substantial undertaking.
Of course, yeah, I think the first step, though, would be to even assess across the state what assessments and what process we're using, because there's been no attention paid towards that yet at the state level. So I think that would be important to do if possible.
I think that's a great suggestion to even figure out what everybody is doing, and maybe that's one of the things that we should do in terms of an initial focus on. Evidence base is like, what are the assessments going on and what should people be doing, and is there kind of a minimum approach or not? But I may be getting ahead of myself, but those are some of the things that we are hoping to understand better as we do these organizational assessments, because we really don't have a feel for kind of where are the gaps that people see, what are the needs that everybody sees. And then what we would expect, frankly, is that not everybody is going to be interested in the same topic, so we would be working, say, with a smaller group of agencies who are interested in a particular area, and then another group of agencies who are interested in moving forward and making improvements in a separate area, so that not everybody has to participate fully in all the different work in terms of like the evidence-based work or the promising practices. It really depends on organizational priorities, et cetera. But that's a great question.
Any other questions?
Yes, this is Carol Odnaha from Visiting Nurse Service of New York, Bronx, and Nassau Nurse Family Partnership sites. This question is similar to others that were asked, but all NFP sites are required to use a national NFP database, And so similar to other questions, will there be some type of interface with that database or mechanism to import the data from that database to the statewide system?
This database is developed for Mich programs, and Healthy Families and Nurse Family Partnership have their own database. We may do some crosswalking to see particular clients that are being touched by all three systems, but this database is exclusively for the Mich program.
Okay. Thank you.
Yeah, there will be some assessments about partnerships and some other aspects of that you know wouldn't be content that you're going to be putting into your client level data that you enter. So there may be some additional data, but it wouldn't be at the client level. There's other questions? Okay, it sounds like everybody is kind of questioned out. I want to thank you all for your participation. Erica, anything else from the state's perspective that you'd like to share as we close?
No, thanks. That was great.
Okay.
Well, thank you everyone for your participation, and you all had very good program questions that will be helpful to us in our internal process here as well. Many that we also had as well, and we look forward to working with you and clarifying all of our activities here. And I look forward to our interviews and getting to know you all as well. You have a good day.
Thank you all.